once again, we are back on Ek Moon Soch Ki Tea Talk Train of and Thought with a series of an episode with Dr. Chris D'Souza. So it's an amazing journey to what you had. Your interest was more into karate, and then how the passion came into medicine, the kind of qualifications to what you had, and you are very well known ENT surgeon in India and world over. So now, in fact, when we talk in terms of the most important organ of an human being, the ear, nose, and the throat, so what are the common symptoms which are there as far as the ear infection which is concerned in general?
The commonest symptom is, of course, pain. Then comes discharge from the ear, pus. Then can be lessened hearing. Can get a humming sound which is known as tinnitus, and of course vertigo. These are the hallmark symptoms of any problem coming from the ear.
Okay. And when we talk in terms of nose, what are the causes of breathing problems which are there?
The causes of breathing problems are, one, of course, if the person has a deviated septum, that means the bone that divides the nasal cavity into the right side and the left side, if that is deviated or bent, that can cause nasal obstruction. But of course, there's also the quality of air that you breathe that can initiate a whole series of problems. And of course, a person's own immunity. If the person has got an allergy, then they will start sneezing and things like that. But these are the common causes of problems in the nose.
Okay. Then how about this throat discomfort, like we in COVID-19, through a lot many challenges, in terms of breathing problem and some throat problem which are there.
The lining of the nose and the throat are the same. So if a person lands up with an infection in the nose, it will definitely travel down. So the commonest cause is, of course, throat pain. Then the person will have fever, and if you look at the throat, you'll see that there's pus. At the back of the throat, you'll also see that the whole throat is red and swollen. So these are the commonest things that a doctor will encounter.
So now, in fact, we are seeing you have been part of Tata Memorial, then Holy Family Hospital, Leelavati Hospital, and the other prominent hospitals which are there in Mumbai. And apart from your own regular practices, you're also passionate of the number of books which you have written, challenges in the pandemic, then implant hearing devices, then head and neck cancer care in a pandemic. Can you throw some light on head and neck cancer care in pandemic book which you have authored?
This is a very valid question. The thing is that the reason why I decided to write these books in the pandemic is we're living in historical times. And there was a lot of misinformation going around. So this book was written to throw away the misinformation and provide patients with real information. Because cancer will not remain stagnant. It will continue to grow. So when a person comes to us with COVID and with cancer, then we have to decide which gets priority. And unfortunately, in the pandemic, I've seen many people who are so afraid. They're more afraid of the pandemic than of their cancer, that many of them went on to get advanced cancer and then succumb to that problem. So in our book, we show doctors how to deal with this and prioritize it. That means which gets priority. And we can still operate on these patients, save their lives, and at the same time treat COVID-19. Then also we have to deal with telemedicine. That is to say, if one member of the family is admitted in one hospital, the other in another hospital, it's very important for them to remain connected, because being isolated, everyone's wondering what happened to that family member. So we developed a connection to alert every family member as to what is going on, so they could take comfort on video calls that their beloved ones, their loved ones are safe, or that they're being treated in a very competent manner. Very often when patients would pass away because of COVID and the family members were quarantined, many of them could not accompany the body for the last rites. So we had to assign people who would take care of that. Absolutely heartbreaking scenes. And so we cannot remain cold and isolated. We had to reach out and help these people to make that connection, especially for their beloved ones, for their last rites, and provide them with a lot of comfort. So I wrote these books so that we give the people who are most impacted with this by doctors. They will say, shall I give this or shall I do that? And they're often misled. So the books that I've written were to provide absolute valuable guidelines which they could follow and effectively treat patients. I myself had been exposed. I went each and every day into the COVID ICU. Because I realized that I was living in historical times, I used to take a small Sony cyber-shot camera and document things like this. At the same time, treat patients. I am happy and proud to say I did many surgeries, and in that, I was well before the vaccine came. I protected the patient, I protected the staff members, so no staff member got COVID from treating these patients. That's a very, very important record, for which I even got a commendation from the Pope Francis himself, who gave me a letter of appreciation saying that while we treated patients, I protected the staff members from getting this well before the vaccine came along. So I've taken many of the photographs in this from my own personal collection, which I took with my Sony cyber-shot. And I realized that I was living in historical times, and I need to validate that experience by being scientific, at the same time being caring for the patient and for the staff members around me. I cannot be a cold clinician. I have to have a lot of empathy and know and help these patients make connections with their beloved ones who are waiting outside and wondering what was happening.
Sir, आपको कोटि प्रणाम. Imagine Dr. Chris D'Souza in this tough situation of COVID-19 pandemic, when I think entire world were fighting against that, and Dr. Chris D'Souza with an ethical practices, with his passion towards the medicine, saving the life as far as the humanity which is concerned, and in that process, in spite of being busy 24/7 with the responsibilities towards and society, and in the process, since there wasn't panicky, and in that panicky, like sir came up with a head and neck cancer cure in a pandemic, which I think those thoughts which are there in the mind, if it is jotted down in a book form, I think that is a one which gives back to society, so that doctors can follow what they need to do as for the pandemic which are concerned. Now this is an exclusive story of Dr. Chris D'Souza on Tea Talk Ek Boond Soch Ki. I'm sure we are going to catch up with Dr. Chris D'Souza in a further episode. Please keep on watching Tea Talk Ek Boond Soch Ki, train of thoughts. Thank you very much. So thanks a lot.
Thank you, sir. Thank you.